Neprinol Advanced Fibrin Defense is the world's strongest blend of systemic enzymes. What is Neprinol? Let's take a look at each ingredient. Nattokinase, a fibrinolytic and protein digesting enzyme that is able to support normal blood viscosity and cardiovascular health. This enzyme is derived from B. subtilis natto, a probiotic, and we're really using it to keep the blood super clean. We also add in serrapeptase, another protein digesting enzyme derived from a probiotic, Serratia E15, and we're really using this enzyme to support a normal response to injury and also to promote a normal inflammatory response. Additionally, we add in lipase, which is able to break down excess fat in the bloodstream, like triglycerides. Protease is also added. This enzyme has a generic name. It is a protease and it's called protease, and the reason for this is it's derived from many different microbial sources. So where the nattokinase was derived from B. subtilis natto, the protease is derived from several different microbial strains. Anyhow, this increases the protein digesting ability of Neprinol and also improves immunity. We also add in bromelain, which is a proteolytic enzyme derived from pineapple. This enzyme acts within the body to promote a normal immune response, and it's able to help maintain healthy skin conditions. Amla, derived from Indian gooseberry, contains tannic acid, glucose, cellulose, and calcium. Amla helps maintain normal acid and pH balance and is traditionally used as a nerve, brain, and hair tonic. We also add in rutin, a flavonoid or plant pigment that helps maintain strong capillaries and connective tissue. Rutin will actually improve the elasticity of the cardiovascular system. And finally, we add in CoQ10, which is able to decrease the proliferation of free radicals, and magnesium, which promotes a healthy cardiovascular system. And the main reason we add in these last two ingredients is because these are coenzymes, and you really need these coenzymes in order for a chemical or an enzyme chemical reaction to take place. So we have found that people that supplement with high levels of, say, one enzyme like bromelain or serrapeptase, over time they can become deficient in CoQ10 and magnesium. So we include these in the product so Neprinol will actually work better and you won't become deficient. What does Neprinol do? Systemic enzymes are able to thin, detoxify, and purify the blood, completely improving cardiovascular and cellular health. Neprinol can also be used as a non-toxic anti-inflammatory to reduce bruising and swelling. It's a great alternative to Tylenol or Advil. And most people use Neprinol to calm autoimmune responses. They can take Neprinol and a lot of times reverse arthritis symptoms by completely cleansing the cardiovascular system. Now, all of these conditions have one thing in common, whether you have heart disease, arthritis, or a broken ankle, and that one thing is high levels of protein in the blood. So if you clean the blood, you're able to reverse a lot of these symptoms. One of the most important proteins that I want to talk about is fibrin. Fibrin is a cross-linked protein formed in the bloodstream. Fibrin is necessary for healing to occur and is produced as the result of injury or sickness. So if you look on the right, that picture is red blood cells and the spaghetti looking cobweb stuff, that's fibrin. And if you have too much fibrin, that's exactly what happens. It acts like a cobweb and traps all sorts of toxins. So fibrin's created in response to injury, infection, disease, cellular damage, virtually any immune response. So basically what happens is your immune system signals that there's something wrong, and it just produces tons of fibrin, sends it out and says, go fix the problem. So we like to call it life's little band-aids. So let's talk about the relationship between plasmin, your body's own natural protein and fibrin digesting enzyme, and fibrin. The production of fibrin is not a perfect system. Anytime there's an immune response, your body is going to produce far more fibrin than it needs. But to keep this system in check, you have a large amount of plasmin circulating in the bloodstream to break down any excess fibrin. So a younger person or anyone before the age of 30 has a large amount of plasmin, which does not allow any fibrin to build up. Unfortunately, after the age of 30, all of the enzymes in your body diminish quite a bit, and your production of plasmin significantly decreases. So because of this, fibrin begins to build up. So this is why young children don't normally develop autoimmune problems, because they don't have this cobweb effect that fibrin produces. See, if you have too much fibrin, like I said before, all sorts of toxins are going to begin to build up in the bloodstream, and your body really doesn't know what to do. So your immune system reacts, it causes inflammation, and all of a sudden you have arthritis or fibromyalgia or something like this. So Neprinol has been shown to be more than 10 times stronger than plasmin. So as you age, taking a product as strong as Neprinol is one of the most important things you can do. So excess fibrin can be responsible for increased body pain, just overall pain everywhere, high blood pressure, dangerous blood clots, all autoimmune disease, especially fibromyalgia and arthritis, increased LDL or bad cholesterol. Basically all blood values can be elevated, triglycerides, cholesterol, you name it. Prolonged recovery, you're taking way too long to recover from surgery or injury. And trapped blood toxins. I mean, just tons of chemicals, undigested food, all sorts of things in your blood that should not be there. And what happens is it causes this permanent inflammation or this permanent inflammatory state. And we all know that inflammation is the beginning to all disease. Now let's take a look at a case study that was performed on Neprinol, and we're going to look at some blood slides that were looked at. This is dry blood microscopy. And anyway, the blood slide you see here is untreated blood before Neprinol. This patient had severe arthritis and fibromyalgia. They were taking NSAIDs daily, at least 2 to 3 doses per day. And they had, you can see here that they have high white blood cells and a ton of fibrin in their blood. And I can tell you, everybody in this study, whether they had arthritis or fibromyalgia or heart disease or diabetes, all of their blood looked the same. They all had a ton of fibrin. 6 months later, you see treated blood after Neprinol, and this patient virtually has no symptoms. They have no fibrin and decreased white blood cells. The NSAID use has stopped. They stopped taking their Tylenol and their ibuprofen daily. That actually stopped after 4 months. And again, they report very little to no symptoms. And I can tell you, when this study was performed, Neprinol was only about half as strong as it is now. We're always constantly improving this formula. And now people are going to get results in half the time, if not faster. So in this same study, we did normal blood tests as well. We didn't just do microscopy. We also wanted to look at the numbers. So this other patient we're going to look at, he's a 45-year-old male with osteoarthritis. He's got chronic pain and inflammation in both wrists and elbows, and he takes NSAIDs every day just to use his hands and arms normally. So we decided he's going to take 2 Neprinol capsules twice daily for 6 months. And he did amazingly well. Low dosage treatment for 6 months eliminated inflammatory blood markers and restored normal movement. Patient has completely eliminated all NSAID use. And one of the blood values we can look at is C-reactive protein, probably the most important blood marker when we're looking at inflammation. So you can see here on his initial visit, his C-reactive protein level was 13.7 milligrams per liter of blood, which is anything over 10 is persistent inflammation. Anybody that has heart disease or arthritis is going to have a high level of C-reactive protein. And you can see each 2-month visit, his C-reactive protein level significantly decreased, and at 6 months it was down to 2.8, which is right in the average range, which basically tells us that the total body inflammation has been completely removed. So we're always talking about how strong Neprinol is. Well, let's look at the Neprinol activity. We actually had a third party do a fibrinolytic unit test on Neprinol and all of our competitors. And you can see here that Neprinol was over 36,000 fibrinolytic units per gram. And one of the most popular products on here, Wobenzym, was just around 6,000 per gram. So the ability of Neprinol to break down protein in the blood is, on a per gram basis, at least 6 times stronger than Wobenzym. And recently Neprinol was just tested again, and it was over 50,000 fibrinolytic units per gram. So based on what you're getting, Neprinol is very inexpensive. So this comparative test demonstrates how well Neprinol disintegrates fibrin and other unwanted materials in the blood. Who should you be able to recommend Neprinol to? Anybody that wants to improve circulatory health, if they have really thick blood or high cholesterol, maybe they want to increase circulation because they're diabetic, Neprinol is going to be an excellent choice. Also, anybody that has any autoimmune conditions, whether arthritis, osteoarthritis, fibromyalgia, MS, the list goes on and on. If they want to improve reproductive health, a lot of women have taken Neprinol for its anti-inflammatory properties, but then they began to notice that their fibroids began to go away, and the pain and inflammation from those fibroids, or even pain from endometriosis. Any inflammatory condition, whether it's an autoimmune disease or you're trying to recover from an injury or surgical recovery. And then finally, fibrosis. People that have pulmonary fibrosis do exceptionally well when taking a product like Neprinol.